This patient information DVD was made for the Prince Charles Hospital in Merthyr Tydfil, South Wales. It is a unique reference source for patients and families for the diagnosis, treatment and follow-up of colorectal cancer. This DVD contains an information insert with steps for use for those who are not completely familiar with the operation of a DVD player. More significantly, on the reverse of the insert is a detailed flowchart highlighting the key stages a patient may take during diagnosis, treatment and follow-up. During each confidential patient consultation, the flowchart can be marked to indicate which tests are required. The patient can then refer to this later in the comfort of their own home. Colorectal cancer or bowel cancer affects roughly 1 in every 25 people in the UK, with over 30,000 new cases diagnosed each year. Early diagnosis and expert multimodality treatment are required to achieve successful results. Care for patients with bowel cancer is provided by a specialist multidisciplinary colorectal team led by Professor P.N. Hooray, consultant colorectal surgeon.
You would have been given this DVD by one of the members of the colorectal department, either because you've been diagnosed with bowel cancer or because you're strongly suspected to have bowel cancer. Now, this can be a very difficult time, not just for the patients but also for their families. And it's precisely for that reason, to support people like you, that we have created this DVD, which takes you through the process of the investigations, the tests and some of the treatments that people would have to undergo. In the majority of cases, bowel cancer is caught early, and when it's caught early, it can be cured. And occasionally, even in those patients where it's a little bit more advanced, there are plenty of treatment options available compared to a few years ago these days. I hope that you find that this DVD helps you as you go through the process of your investigations and treatment for your condition.
Following your referral from your GP, your visit to the Rapid Access Clinic and your clinical assessment, a series of tests will have been decided upon to diagnose your condition. You will then visit either the radiology or endoscopy department, or in some cases both. For the purpose of this DVD, the first section we shall concentrate on is endoscopy. This DVD takes the viewer through the journey of diagnosis and treatment of colorectal cancer in a supportive environment with an opportunity to virtually meet many of the staff. There is an option to view a continuous film which takes the viewer on a virtual journey of the patient pathway through all the steps from the very first outpatient consultation, through various diagnostic tests, and demonstrating the role of the multidisciplinary team meetings in the decision-making process right on through the treatment and follow-up. There are also extra sections with invaluable information on patient experiences, stoma care, chemotherapy and radiotherapy, and a glossary of definitions and contact details. The ease of the interactivity of this product allows the user access to as much or as little information as they want on many aspects of the patient pathway.
As a group of professionals dealing with this condition on a regular basis, we are all very aware that this can be a very worrying and difficult time for patients and their families. This film has been made possible with the help of many of the staff here at Prince Charles Hospital. I hope that it gives you an insight into what to expect during the process of having the diagnosis and treatment for bowel cancer.